Hello, welcome to Let's Get Down to Business with the Prince Rupert and District Chamber of Commerce. We are here to give a voice to our local business owners, entrepreneurs, and community leaders to strengthen and support our local business community and to share the wisdom and experience of longtime business leaders and the fresh ideas and experiences of new entrepreneurs. So let's get down to business.
Hi, my name is Daphne Thompson, and I am the president of the Prince Rupert and District Chamber of Commerce. Today, I have the privilege of speaking to Dr. Tania De Klerk from Aveline. Tania, thank you so much for being on our show. Would you mind,
Daphne,
please, starting with telling us a little bit about Aveline?
all right. Aveline Mediclinic is a clinic that I started a couple of years ago that offers aesthetic procedures as well as other services, including screening for skin cancers, including dermatology consultations, and also I have a medical weight loss program, which is obviously one of the things that I'm really the most proud of.
Tania, the name Aveline, where did that come from? What's the meaning behind it?
So my nephew had a girlfriend. They came to visit us, and she is into all of this, creating logos, and she was quite brilliant. So I got her and a few of my other family members to help me think about names, and she came up with this name, and it basically means life because it refers to plants, to hazelnut. So I thought that sounded nice, and I like the meaning that it refers to life, because that's what medicine is about, and this is really related a lot to my work as a family physician. So also the four little they look like little plants, or leaves rather. So she did that as well.
The logo.
The logo of Aveline, yeah. I don't know if you know what it looks like, but that's basically the meaning behind that, is life, wellness.
That's amazing, because the four almost chambers of the logo could also like subliminally refer to like the heart and how that gives life to the body, and you give life to healing the body in all these different ways.
Yeah, we try to. Yeah, and that's why I liked it. I mean, she did a lot of other things, like related to harbor, or, being by the ocean and whales. And we had quite a different opposite options. And for some reason, I just really immediately loved that one.
Well, that's the fun part of starting a business. Like, you get to create the brand, you get to create everything that you're doing. So starting about creating, like speaking about that, tell us, how did the business Aveline come about? Why did you start the business?
That's a good question, Daphne. If you asked me 6 years ago, if I was going to do something like this, I would have like, no, not a chance, because we're so busy up here as family physicians. And then I just at random times had different patients approaching me, asking me, Dr. De Klerk, do you do Botox? I'm like, no, I don't have time, no. And then more people. And then they said, well, because we live so far away from everywhere, they have to literally fly to Vancouver, or have to drive to Prince George just for Botox. And so then I guess after maybe a year of having different people asking about that, I thought one day, well, maybe it'll be fun. Maybe I should do that. And then I went to Arizona in winter, Canada. So of course, Arizona was the choice, because Vancouver and Toronto aren't that great in the middle of January. So I went to Arizona with the idea of just doing Botox and, getting to learn to do Botox at first, because that's what I had in mind, as per the request of my patients. And then on those conferences and training weekends, you are exposed to so much more. So the idea of just doing Botox now and then for a patient here and there started gradually growing bigger and bigger, learning more about different services that we can give people here in Prince Rupert, because they were none at the time when I started. So yeah, that's how it started.
So it started out with Botox, right? And what was the next thing that you saw the need of?
So the initial thought of the training was to just do Botox and filling, but my actual training in Arizona, initial training already included the medical assisted weight loss. It also included chemical peels, microdermabrasions, even lasers, and that just making you understand that these options are there and teaching you where it's appropriate, which patient would need what. I did initially just start with Botox, because that's the thing with a small business, right? You can't, this is a very expensive line of service. So I couldn't just start with everything at once. It was just too much. So I did start out initially Botox, fillers, and then we added chemical peels and microdermabrasion, and then we added microneedling. So over the time, added things, but the weight loss was also started right from the bat, right off the bat. So yeah.
So tell us a little bit more about this. I find it fascinating. So what exactly is a chemical peel?
A chemical peel is basically a substance that you put on, substance, if you will. It usually consists of different acids that you put on the skin that changes the skin, the dermis, on a chemical level, and that improves fine wrinkles, pigmentation, acne. It was wonders for acne. There's rosacea. So there's quite a bit of actual medical illnesses that also improves with that. And of course, it makes your skin look younger. Our skin, the skin turnover as we get older slows down. That's why our skin starts to look dull and gray and that. And so young children, their skin turnover is so good. So that it also improves the skin turnover. So for young people doing chemical peels, not only the ones that come for acne, but some of them just come because they want their skin to glow a little bit more, because it basically just, you don't necessarily peel. I know people think, yeah, there can be flakiness and that, but not always. So it's also about the chemical changes in the skin.
Wow. And some of the other ones that you mentioned, the microneedling?
Microneedling is what I have is a pen with 12 microneedles. So it's really, really tiny needles. And then you cause micro trauma to the skin. So you go over the face with that needle, and it like this effect into the skin. So causes micro trauma. And the micro trauma forces the skin to heal itself. So that is for overall like fine wrinkles, and that obviously it does improve that, but also for skin pores and the general skin tone, acne scarring. Yeah, so because the skin is forced to heal itself by the micro trauma that we introduce. And sometimes we use different vehicles on the skin. So most of the time we'll use hyaluronic acid. But I also do PRP, which is platelet-rich plasma. So I'll take blood from the patient, we'll centrifuge it, and then so separate the red blood, white blood cells, and just have the serum with the platelets, and use that on the skin with the microneedling. The PRP we actually also do for alopecia, which means hair thinning or hair loss. So yeah, so we do that. So take blood from the person, use their own plasma with platelets, and inject it into the scalp where their bald spots are.
This is fascinating. So you're making use of a medical industry and your knowledge as a physician in order to also assist people in their almost aesthetic looks and help them feel better about themselves that way.
Yes, I can tell you that so many of patients that come to us, yes, of course, there's a lot of patients coming for Botox, but those coming for Botox is not just because of I want my wrinkles gone. A lot of people come for Botox because they have chronic migraines. A lot of people come for Botox because they have bruxism, which is grinding on your teeth. So, when you sleep at night, you grind your teeth. Not you, but I mean, a person. That really does help because people wake up in the mornings with severe headaches. And of course, it damages their teeth. It cracks the enamel. So it has dental benefit as well. And then people come for Botox for hyperhidrosis, which means excessive sweating. So yes, Botox is one thing and fillers is one thing, but so many people come to Aveline because they have skin problems, acne that's not responding, or even just weird sores on their face that they don't know. So I'll have a look and see. And if I don't know, then I'll take pictures and I consult a dermatologist and get help and, call them back. So we do a lot of that. And like I say, the medical weight loss program, yes, of course, we all like to look good. But it's not about that. People can stop taking some of their high blood pressure medication, some of their diabetic medication, people with chronic pains and aches, because it's a really good detoxifying diet, improve, like celiac disease improve, chronic joint pains improve, even chronic migraines improve. So, and that is, as a physician, makes me happy because I see how people's health improves. So it's not just aesthetics and vanity, Another thing that we do in this business is, like I said, looking for skin cancers. So that started after I was at a conference in Vancouver, a family medicine conference. And then it was about dermatoscopy. Dermatoscopy is like a handheld little magnifier lens, if you want, or if you wish. It magnifies what you can see with the naked eye with at least 10%, like 10 times. So a lesion that might look really nasty with the naked eye, when you look through the lens, you can see, oh no, it's just this and this and this kind of a nevus. Or the other way around, something can look okay with the naked eye. And then when I look through my dermatoscope, then I see things that is impossible to see with the naked eye. So again, I decided to do that because I had a patient who used to travel to Victoria to see a dermatologist for her full body dermatoscopy to look for skin cancers. So we do that too.
I love that you customize your services to the actual needs of the community. A community member would come to you and say, hey, I'm struggling with this, and you find a solution for them. It's very personalized, and you train yourself up in order to be professional in that and to have the certification. So I want to applaud you for that. I think that is a brilliant business technique, first of all, and second of all, that you are finding different ways to help the community. That's just amazing.
Thank you. Yeah, I come from a really rural area in South Africa, and I know how hard it is when you have to travel everywhere for everything because there's nothing where you live. And so maybe that in mind, subconsciously, I don't know, but I just feel like if it is something that I can add to what I can offer to my patients, I love being a family doctor and I love helping my patients on every possible level that I can. So doing that, gives me the satisfaction that I'm helping them, not just looking pretty for their Instagram selfie, but also, helping them
medically
be healthy, feel better, so yeah, I think that is maybe a big motivation because we live so far away from bigger centers.
So tell me about this medical weight loss. When we chatted offline a little bit, you were telling me how this is the most popular service as well.
Yes.
So please tell me more.
Well, I can't tell you what it involves because that's going to be a long conversation. But I can tell you that this diet comes from the early 1960s, and it was actually started by a gynecologist, Dr. Simeon, who went to India and then had some certain observations in that. So yes, it does involve daily injections by yourself. And it does involve weekly injections by my office, weekly injections by myself or one of my staff members. The weekly injection is for liver support, metabolism, and all of that. But before I can put someone on this diet, they need to come to me so I can examine them. So I do a full body physical examination, make sure that they are good, to do this diet. And then we go from there. So at the end of the diet, we not only see how much inches they lost or how many pounds they've lost, but we also check their blood pressure. How is your blood pressure improved? So yes, the medical weight loss clinic, I have patients who come in more than once until they eventually reach the goal that they had initially. So it is possible to do it more than once. And my staff is very supportive with that. I actually took one of my MOAs with me to Arizona once, who also had the training in this diet. So she's also quite knowledgeable about supporting people if I can't be around to answer the questions.
And I know that you told me that when you started this out, you were your own very first test bunny. Tell us about that experience.
Yes, well, I actually, when I enrolled in the training in Arizona, I did not apply to do that weight loss. And then they phoned me and they asked me, you enrolled in all of the training except for the weight loss. So I told them, well, I live in Canada. You guys are US. I don't even know what that involved. And I didn't know at the time if it was FDA approved in Canada. So then the person told me, well, Dr. De Klerk, I'm phoning you from Calgary. So I said, well, in that case. So then I enrolled in that. Very skeptical initially, of course, when I was sitting there asking so many questions. I think I drove the guy nuts. But eventually did the training, came back, and then I had me, myself, my sister, and a few other people, as guinea pigs on this diet. And I did gain a lot of weight after moving to Prince Rupert, and I just couldn't lose it. Sometimes I would work out twice a day, and I just really could not lose the weight. So I did that diet, and for the first time since I moved to Prince Rupert, I actually managed to lose weight, and I had energy. That's one of the side effects of this diet is you have so much energy. I felt. My husband, one Saturday, I could not stop cleaning the house. And he's like, what is wrong with you? And I'm like, I don't know. I just have so much energy. Yeah, so it really helped me. And because of personal experience and benefit from this diet, it's not something that you have to be dedicated and you have to really want to do it, but it gives you the tool to do it more than anything I've seen. So yes, that was my personal experience. I can go on for hours about my personal experience, but I don't think we have that time.
Well, I personally enjoy hearing about the personal experiences about something, because that's how I connect. And I'm sure that's how our listeners feel as well. If we know that you are passionate about this, you've got first-hand experience, it does draw us in. It makes us connect to you a lot better. I feel like I've known you for years now. I feel like we are best friends after this, and there's just more things that I would like to ask you. So the next thing is, tell us, how did you actually get to Prince Rupert?
All right. So when I immigrated from South Africa, the first stop was Manitoba, 2.5 years, which was a little bit brutal for a South African to get used to. So we only lasted 2.5 years there. Then we moved to Invermere. I knew people there, a lovely place and that. But I don't know, something about the medicine in Invermere started to frustrate me. Outside of tourist season, it could be so dead quiet that I didn't like that. And Invermere didn't have an OR, it didn't have a lot of the things that was offered here. So after many years of having Dr. Kloppers moan in my ears to come and have a look, I decided to come on a site visit. And after that weekend, we just knew this was it. I love the people that I met. I met not only the physicians at the time, but I also met people outside of the medical society. So, and I just felt, I felt like this is, I like this place. I like the medical opportunity that it had. It reminded me a lot more about South Africa, dealing with real disease is what I like to do. And then after moving here, within a year or 2 years, I felt, me and my family, I'm talking for my family as well, we just felt a part of this community. This is a really lovely community, so supportive, think about Jen, who now started this hashtag Just Ask campaign. Have you seen that?
Yeah.
Have you seen that?
Yeah, but tell us more. Not everyone has.
Okay, so yeah, so Jennifer is the general manager of Aveline, and I really need to mention Jennifer Kloppers here, because not only, if it wasn't for her always pushing me, always, Dawn, we have to do this, Dawn, this, because I'm like, I'm busy, I'm on call, and I'm going to be post call, then I have to do a home visit. She would always, make sure that things went forward. And then, unfortunately, a month ago, well, in August, I diagnosed Jane with breast cancer, grade stage 2 breast cancer. So she had her initial surgery, and now, but then she made this video where she's telling the public about what happened to her, coming to me, we did the exam, did the test, it's breast cancer, now we're dealing with the process. And she's aware of the fact that not everybody does have a family doctor, and she's aware of the fact that not everybody can come in quickly and struggle maybe to get mammograms. So hashtag Just Ask is we offering, especially for the month of October, we want people that come to Aveline for whatever treatment, and this is Jen's idea, whether they come for a microdermabrasion, whether they come for Botox, doesn't matter what they come for. If that person would like a breast exam performed by me because they can't get in with their own family doctor, then just ask. So we're doing that for the month of October as part of the, October is breast cancer month, right? So we have this special campaign. We'll be wearing pink scrubs in honor of breast cancer survivors, in honor of breast cancer patients going through that. Yeah, so that's Jennifer Kloppers that's doing that. And every week when you see a hashtag Just Ask on Facebook or Instagram, that's Jen.
Shucks, that's so heart moving. But
yeah, I have to say, I cried the first time she showed me the video. Before she put her Instagram, she's like, Tana, I want to show you something. She showed me the video, and I mean, we are very close, so of course, cried a little bit, but
so yeah, just come to Aveline and just ask.
Exactly. And even, I mean, we are always on a Thursday afternoon from 3 to 6, on a Friday afternoon from 1 to 5. Aveline is always open. And I tell people, if you have something about your Botox that you don't like, if there's a procedure that we did that, if there's something that we can do to improve it or fix it, people know they can come. And I want people to know that, and especially for this month, the Breast Cancer Awareness Month, really, it's a very important thing for us, of course, because it's so personal. It's so close to us right now.
Yeah. Wow. I feel like usually my last question for any business owner is, what would you like to leave the business community with? But I kind of feel you've already answered that. You already said, well, just ask. So we come to Aveline and just ask.
Yes.
So,
I guess so. I mean, someone can just say no. I always tell my children they can't bite your head off. You can just say no. So just ask.
That's true. With any venture, just ask. You never know who those people are connected to. You never know what their personal circumstances are. You never know if you might be the solution to their challenges. So
and
just
sometimes
ask.
all a person sometimes all a person needs is just someone that cares.
Yeah.
Even if you can't change what they're dealing with, sometimes you have to give people bad news, or sometimes people have like skin conditions that I can't change. They're on crazy treatment and they still have chronic problems. And sometimes all they need is someone that just cares. So I guess that's for my business, because my business is so strongly associated with me being a family physician. But I think for every business, if you go into a store, like I know if I go into Vancouver and I go into a store, I'm trying to find a dress. I'm going to find a dress in the place where people actually come to me and like, hi, can I help you? Do you need any help with this? That's where I'm going to find a dress. If I just walk into a place and I'm ignored by everybody that works there, and I'm trying to find someone to get it off the high shelf because I can't reach and no one's there to help me, I want to leave the store. So that's with every business, really, is being personal and caring about what you do and caring about the people that you render the service to, I guess, is to me very important.
But that's very important to any business owner. That's usually also your differentiating factor. That's what makes you unique, because no one else have got your experience. No one else has got your background. No one else has got your knowledge. And the way that you communicate that to your specific niche, that's your special factor. That's what differentiates you from someone else. And no one else can do that but you.
You think so?
I am 100% certain that's the unique factor.
Well, I mean, maybe if you put all the different things together and the fact that we also care, I mean, there are, I wouldn't say just me, but I'd like to think that in Prince Rupert, people would like to know, or they would like to believe that we really care. And the business that we're running here is a business which was started to help people to not have to travel.
Wow. Well, thank you, Tania. You and Aveline has really inspired me to also just ask. So I want to thank you for being on the show. Thank you for sharing your journey. Thank you for sharing your input on here.
Thank you for having me, Daphne. I was so nervous. I'm so happy that it's all done over. I survived.
Oh, well, my name is Daphne Thompson, and I'm the president of the Prince Rupert and District Chamber of Commerce. And this was Let's Get Down to Business. Till next time.
Thank you for listening to the Let's Get Down to Business with the Prince Rupert and District Chamber of Commerce. If you would like to be featured as a guest on a future episode, please email us at rupertchamber@gmail.com or direct message us on Facebook or Instagram at Prince Rupert Chamber.